Moderna coronavirus vaccine is 94% effective, early data suggests, but UK has ordered no doses.
Here's a summary of the article.
Britain has secured 5 million doses of a new coronavirus vaccine which early results show is almost 95% effective in preventing symptomatic COVID-19. Supplies of the vaccine are not expected to be widely available until spring of next year, though experts have hailed the emergence of a second coronavirus jab within the space of 8 days as another vital development in bringing the pandemic under control. Interim data released by Moderna on Monday shows that 95 COVID infections have been recorded from its ongoing Phase 3 study, which has enrolled 30,000 volunteers in the US. COVID-19 was observed in 90 volunteers from the placebo group and 5 participants who had received the vaccine, returning an efficacy rate of 94.5%. This will make the vaccine more accessible for the global market, unlike the Pfizer vaccine which needs to be stored and transported at 70 C, and can only survive in fridge conditions for 5 days. Peter Openshaw, Professor of Experimental Medicine at Imperial College London, said, "This is a loud vote of confidence in RNA vaccine technology, which seems to be safe, acceptable and effective in studies of 70,000 people. These results set a high bar for the other vaccines in the pipeline." Dr. Zoltan Kiss, a research associate at Imperial College London's Future Vaccine Manufacturing Hub, explained that Moderna's vaccine uses a higher amount of mRNA per dose compared to its Pfizer rival. Independent analysis of the Moderna vaccine did not find any significant safety concerns.
This post received a score of 52,000, with an upvote ratio of 83%. Here are the top comments in response to this article.
Ordered no doses. Because we already have 350 million on back order with a population of 70 mil.
And since the results came out this morning, they've ordered 5 million of these too.
And we have the AstraZeneca Oxford one which is the same type of vaccine.
Well, there's a reason the independent articles come with an automod warning and sensationalism. Right at the end of the article. There's only so far they're going to spread spending. This looks to be about as effective as the Pfizer vaccine. I would expect the Oxford-AstraZeneca vaccine will be similarly as effective.
To put this into perspective, the UK has a population of 67 million, so assuming each vaccine requires 2 doses and that all options prove valid, then the UK will have 2.8 vaccines per person.
Wow, for some reason, I assumed the UK was bigger than that. We really take for granted how populous the US is.
It's because it's so much more densely populated. To put into context, the US has about 4.9 times the population as the UK, but over 40 times the area.
Wyoming has a similar area to the entire UK and a population lower than that of Sheffield.
I want to go to there.
No, you don't.
Shows you how much I care for Sheffield then, doesn't it? I mean, fair.
This is great because Moderna's vaccine doesn't require the cold storage that BioNTech's vaccine needs. This makes it a lot easier for transport, production, distribution. Not only is it more effective, but it's easier to scale and distribute. Not only that, but in the cases that it doesn't protect from, it reduces severity. This really seems like a turning point in COVID. TBH, and someone will surely correct me, we don't really know if it's more effective, we need more data for that. We know they're both effective.
In my opinion, even if one turns out to be 85% effective, I'd still leap at the chance to get it. I think overall they were hoping for something greater than 50%, so anything above is a massive boost. I think I read that the measles vaccine is 93% effective, so these numbers, albeit maybe a little higher than reality, are hugely reassuring.
Measles has a ridiculously high R_0, so the vaccine has to be really effective in order for it to properly stop pandemics. This is also why even a small group of antivaxxers is a problem when it comes to measles.
Okay, fair enough, I forgot about the R number. With COVID's R number of 1.5 on average, not sure what percentage do you think would be required to be wholly effective on the pandemic?
COVID-19 probably has an R number of around 2, hard to nail down, though. This means that if 70% take the vaccine, you want an effectiveness of over 70% to get to herd immunity through vaccination alone.
This video was automatically created by Reddit to speech. The article and comments in this video were selected from Reddit according to their upvotes, and any paraphrasing was performed by smmry.com, without any human intervention.